Today, I'm going to share with you 5 tips of working with a health coach within your integrative or lifestyle practice. We just finished an expert series with Dr. Scheinbaum, who is the founder and CEO of the Functional Medicine Coaching Academy for our members in the incubator program. And here are the 5 takeaways from that session that I thought were super important and helpful. Number 1 was making sure that there's 2 types of insurance for your health coach coverage. So if your health coach is an independent contractor, we want to make sure that they are named in your personal practice's malpractice policy, as well as if they are an independent contractor, they have their own private policy, professional liability policy as well for them as an individual. Number 2 is that your health coach should be an extension of you. So if you are seeing, as the practitioner, you're seeing the patient during the visit, and you're coming up with or recommending the nutrition plan, an exercise plan, a sleep plan, a supplement plan, lab recommendations, medications, et cetera, et cetera. So all those things that are included in your plan, the health coach should be involved in executing or implementing that plan. They should not be making their own recommendations for labs and supplements, or even dietary recommendations, because that is in fact the practice of medicine, and that is what you are doing as the physician. So making sure that you have kind of set those ground rules ahead of time with your health coach, so they understand that, so you're not overwhelming or confusing the patient. The third tip is to have the health coach be automatically scheduled after your appointment. So the way I did it in my practice is, if I saw the patients, then I would schedule the health coach for about 7 to 10 days afterwards. The reason for that is that I had a couple days to finish my notes, and then the patient had a few days to review my recommendations, and then they had that opportunity to go to that appointment with the health coach, and the health coach could make sure that if there was any supplement recommendations, that those were ordered. If there was any labs that needed to be done, they understood when and how to do that. But then also, they had that built-in support system, so that those portal messages and things like that that sometimes happen right after the appointment, that a lot of times the health coach could take care of those at that time. And so that brings me to my 4th tip, which is making sure that you and the health coach are operating within the same EMR. So we had our health coach, they had access to our EMR, they wrote their notes in the EMR, and our flow was such that I would write my note. Like I said earlier, the health coach would then have their appointment about 7 to 10 days after, but they would read my note, and so they would know what recommendations I had. But then I would also give a few little tips that I wanted that health coach to bring to the table for that patient and discuss with the patient. So, for example, if I had a patient coming in with insomnia, and I might do a bit of a workup or recommend a prescription or supplementation for that, but I wanted the health coach to really get into sleep hygiene with the patient, then I would make them a little note at the end of my patient note. I would put the health coach's name, underline it, and then say, please discuss with patient sleep hygiene, because I may not have time to go through all of that during my appointment with them. But it was very important that we did the sleep hygiene discussion, because that can solve a lot of the issues right there. And I would let the patient know. I would say, these are reviewing these aspects are really important for your sleep quality. My health coach is going to review that at your next appointment. And it could be that for whatever. So if I'm recommending a low inflammatory diet for a patient, and they say, yeah, that's great, but I travel all the time, and it's very difficult for me to eat like this on business trips, airports, et cetera. Then I would say to them, okay, well, read through the plan. I'm going to put it into your chart, read through the plan, and then our health coach is going to come prepared with tips, tricks, snacks, recipes, all these sorts of things, a grocery list to kind of help bridge this. So I would kind of tee up the health coach during my visit with the patient, as well as my EMR note, so that they can easily, execute that. So it feels very personalized and very value driven for the patient. And the other piece is that the fifth tip for health coach, working with a health coach in your cash-based membership practice, is to encourage them to be a full member of the practice. Most of the time, health coaches are independent contractors in the way that we teach working with health coaches. But you want to make sure that from the patient's perspective that they feel like they're part of a fully integrated part of the practice. So what that means is not only one-on-one appointments, but that the health coach is contributing to your newsletter, like a little blurb within your newsletter, that they are teaching a group class, maybe twice a year or 3 times a year on a specific topic that is relevant to health coaching within that scope, or that they're posting on social media, recording a short video. So you want to kind of create that cohesiveness. That way, when you say to your patient, all right, we're going to schedule a follow-up with a health coach, they've kind of seen them, they've seen their face, they've seen them speak, they might see some of their written work, and it just feels like, okay, this is part of it, as opposed to like, oh, this is somebody brand new, I don't think I need them, because we all know how helpful it is to have that kind of support in a practice where you are recommending lifestyle preventative type recommendations, to have that support. So I hope this was helpful, and keep up the great work. Thanks.